And it wasn't all that long ago when it felt like it would be impossible to overcome the rapid expansion of HIV and AIDS cases in our country. But in the last several decades, research and education programs have helped to slow the outbreak. And now, for the first time, the number of new AIDS cases appears to be in decline. Our Katie Muse takes a look at the numbers and what this could mean for Alabama in the future.
The HIV diagnosis rate is on the decline. The rate of new HIV infections among adults and children is down by 33%. And for the first time, Alabama is also seeing a decline in the number of new cases reported. The Center for Demographic Research at Auburn-Montgomery released a study earlier this month documenting the decline in both AIDS and HIV cases. In 2011, nearly 14 people per 100,000 living in Alabama were diagnosed with HIV and AIDS. But in 2012, that number dropped to just over 12 people per 100,000. The news gets better from there, as the study goes on to show Alabama with the lowest percentage of new cases compared to our neighboring southern states. Unfortunately, Alabama still has a ways to go, as we are still higher than the national average. A closer look at the numbers shows that more work needs to be done to stem the surge of cases in the minority community. African Americans made up 68% of the people diagnosed in 2012. To put that number into perspective, African Americans represent just 26% of the state's population. In Birmingham, Katie Muse, CBS 42 News.
Now, according to AlabamaAIDS.org, 4 out of 10 Americans living with HIV and AIDS reside in the South, and Alabama, almost 1/3 of those living with the virus reside right here in Jefferson County. To find out more on the dropping statistics and ways to prevent HIV and AIDS, just head to our website at CBS42.com. Well, the deadline to enroll in the National Health Care Program has